Hi, so I'm here with Betsy Ladyzhets and Miles Griffis, my two friends and colleagues who about a year ago, well, I guess it was in November, co-founded and launched The Sick Times, chronicling the long COVID situation. I probably got the tagline slightly wrong. But in any event, that's your mission. And so why don't you tell me I just wanted to do kind of a wrap up of, how things have gone for the first year, both for the publication and then to discuss, what you've seen happen in the long COVID space and where you see it going. So first, just in terms of the publication, what's happened in the year? Where are you now?
So we've done a lot. Honestly, it's like it feels like it's been no time, but it also is hard to believe that it's only been a year. I think we've been able to put out a lot of stories that we're proud of, ranging from, continued close coverage of the Recover Initiative from the National Institutes of Health to other promising research that's going on to like policy and advocacy stories. And we have worked with a lot of freelance writers who are, great journalists and writers. Um,
Most of the people
and
you're working with have long COVID themselves, or coming to it from that, or are they mostly, or are there many like me who don't have it, but for whom it's something that they're reporting about?
I would say probably the majority of writers we work with have long COVID or a related disease like ME or POTS, MCAS, HEDS, any of those kind of acronyms. Um, Especially because a lot of the pieces we've been publishing have been essays and op-ed type pieces,
Mhm.
which generally are drawing from people's personal experience or expertise. Um,
So in the
yeah.
first, what have you feel like you've been able to kind of scope out as your space? I mean, do you have competitors? Do you think of it that way, or do you feel like you're kind of really, doing this on your own, or what's your kind of sense of what your mission is and how you're going about it?
Miles, do you want to answer that?
Yeah, I don't view anyone as competition. I'm so glad that there are other people who are covering this. I think this is such a big topic, and I wish that we had more, an even bigger staff to really cover so many different topics. But I'm so glad that there are a lot of writers covering different aspects. We try to focus the most on long COVID and related diseases, but we can't cover everything with as much expertise as, for instance, you do with ME and all these trials and different stuff. Like it's just
Mhm.
such a wide topic of space. So I'm so glad that I kind of view so many other writers who are doing this as like the extended universe um, of just people who are covering long COVID and ME because we need more coverage of it.
Well, I kind
I
of feel a little bit like I can focus on sort of what I'm doing because I don't really necessarily have to do the same things you're doing. So I feel like somebody else is doing like taking a deeper look at recover, which I'm sure, could always happen.
Yeah.
But
yeah
I'm not doing
Yeah.
that particularly because I can sort of do my own thing while you do that. So there is sort of a synergy, I think, at work, or sort of a sharing of or balancing of stuff.
yes
Definitely. I think the thing that also sets us apart from, when long COVID is covered by other science and health outlets, as it is from time to time, is that we're really writing for like the patient community, people who, have long COVID or their loved ones, friends, caregivers, researchers in the space, healthcare workers in the space. And we're trying to think about, what is going to be most impactful for those readers, which I think helps to shape, for example, when we're writing about research, we're not going to spend half the article like re-explaining to the reader what long COVID is because we assume you know already.
Right.
We're going to really focus in on like what is coming out of study or like a research trend.
And you're not
Um,
stories about
yeah,
is long COVID real, or that kind of.
yeah, yeah, yes,
right
exactly.
It's like,
Um,
there's a presumption that something's happening there.
Yeah, I think a nice example is the piece that came out in Time a few days ago from a writer. I'm blanking on her name, but she's someone who's done a fair amount of long COVID coverage there.
Jamie Ducarme.
Yes. Yeah, she's great. And that piece that she published recently was about people with long COVID often going into like inpatient psychiatric
Yes,
care
yes,
because
I saw that. I
they
haven't
have
read that.
more. Yeah, it was really nice reporting, and I think that's a great example of a piece where it's particularly impactful for it to be in a more mainstream outlet like Time, because then it sort of adds that like legitimacy to the issue. Um, and the story also has that kind of element of like long COVID is real, like you're a bunch of doctors saying like all of that, etc. And yeah,
So,
so I think it's nice to have those kinds of stories as a complement to what we're doing.
have you heard reactions from people like, why do you want to bother with, like, why are you doing this? Has that been a question, not from patients with long COVID, but sort of from other people? Like when I, began writing about chronic fatigue syndrome was then called, nobody could really understand why I was doing it. This is a different situation. But have you had sort of skepticism or pushback or people like, why do you want to spend your time on this? Or has that not really been an issue?
Not really. I think especially when I frame it to other journalists as like, hey, there's this community of people who we're serving, I think that kind of helps.
Mhm.
We think of it as a community-driven publication, almost like a local newspaper, but not for a specific geographic region, but for this like disease, this disease community. And so I think people kind of understand that it's like a significant number of people who should have a
Mhm.
news outlet.
Mhm.
Um, yeah.
And so, what else have have there been surprising things that you've come across or found out, or things that just unexpected, or, what are some of the things that you've learned, I guess? Anything you want to share along those lines?
Yeah, I think for me, it's been, I mean, when we launched, it was just Betsy and I like working for free, basically trying to like figure out how to launch an entire publication. And I I knew that we could make it a sustainable thing over time. But it's been like surprised, like it's just shown like how needed more stories on long COVID are. Our socials keep growing pretty dramatically. Our stories have a lot of reach. We're getting like millions of impressions on Instagram and these other social media apps. So people are really, there's like a real need for this content, for reported stories, for commentary. And it just sort of validates how big of an issue long COVID is and how many people are affected. We see these studies showing 10 to 20% of people. And it just shows how real this problem is and how many people are affected.
Do you find, is your readership primarily US, or can you get a sense of how much you have international readership as well? Like for me, obviously a lot of the people I write, a lot of the studies I write about are British ones or UK or Scandinavian or whatever. So I tend to probably think I have more people following me in over there than I do in the US. I'm assuming your publication's more US centric. So you probably have and you're obviously following the U.S. political aspects in terms of the funding. So do you find that you are predominantly U.S. Readers, or what's your sense of that?
Yeah, I think predominantly US, probably due to the fact that a lot of the, as you said, the like policy landscape that we're covering, and also the kind of acute COVID, like continued pandemic aspect, it tends to be more US focused. But we definitely have a decent amount of international readers as well. I was actually just looking at this yesterday because we are getting ready to send stickers and thank you notes to people who donated in our end of year fundraiser. And that's around 500 people, and about a fifth of them are international. So I need to order some international stamps. So
And
that's
so
one data point.
in 3 days, we enter a new unprecedented era in the United States with a second Trump person in charge. Um, I hesitate to even say person, but whatever. Whatever he is, in charge. And what do you see an RFK Jr. possibly coming in, and so on? What's your sense of what all this does? And nobody can really know, but what is your sense of what all this does to sort of long COVID funding, research into long COVID, and so on? Benefits for people with long COVID, and some of the kind of legislative initiatives that that are being talked about.
Yeah, I mean, I did a story about this. couple months ago, after the,
Right.
election results. And definitely a lot of uncertainty. It's very hard to say what exactly is going to happen, especially since Trump and some of his nominees for the various health agencies are kind of wild cards. Like RFK Jr., for example, he talks about wanting to address chronic disease, but that he also wants like zero funding for infectious diseases, which is like
Right. I mean,
literally makes no sense. I think it was Jamie Seltzer who said this to me when I was reporting that story. Like, long COVID and ME, like these are chronic diseases that primarily occur after infections. So like how do you kind of square that, right? Like there's just a kind of fundamental lack of understanding of science that comes from figures like that. And so I think it's kind of hard to know what they're going to do and also how much of an impact they will really be able to have on our very entrenched and like complicated and weird healthcare system that we have in the United States. So yeah, I think it's hard to say. I mean, a lot of the advocates I spoke with for that story, are very determined to kind of continue pressing on. Like the long COVID campaign, for example, which is led by Megan Stone. I think they just publicly announced this, so it's okay for me to say. But they're preparing a Hill Day for long COVID advocates that
mhm.
they're planning for, I think, March of this year. And so that's going to be the first ever day, like official kind of lobbying day for people with long COVID to come to DC or like participate virtually, um, and, talk to their representatives, which is something that I know various groups have been trying to do for the last couple of years. And then in addition to all of the electoral stuff, I think there's been so much energy in the last couple of years in like mutual aid and other kind of more on the ground organizing that is less tied to the political system.
Mhm.
Um, I mean, we just published a story last week about the LA, Los Angeles mass block and other COVID advocacy groups in that area responding to the wildfires, giving people
Mhm.
free high quality masks. And so stuff like that is happening all over the country, and that doesn't require, that
Right.
continues regardless of who the president is.
Well, I guess one
So
question: what is the overlap, or what is the impact of what's going on in LA, or what has gone on in LA on long COVID? Um, uh, just as we think about it, like what are the impacts on people with long COVID for the fires? More, I don't know more, but differentially perhaps.
Yeah, I mean, we know that, like, I live in Los Angeles. We know that uh, wildfire smoke is super toxic. Um, all the particulate matters, we know there's toxic, other toxic chemicals that can even get through masks. Um, so we know, and we also know that people with long COVID and other associated diseases are, much more likely to be affected,
Mhm.
as our baselines are already quite low, and it can cause crashes, cause other issues. Um, I think the fires have put more attention on masks, and I think people are making more connections. There's been so much politicization of them over the years, and it takes events like this to really show people how important a good like N95 is in wildfire smoke, and how it also protects. We're in a COVID surge as well, so people are in evacuation centers. People are having to stay with other families and friends in larger houses, so it there I think people are making the connection that it can protect you from both of these things. And unfortunately it has to come because of a large wildfire. But there's also been so much attention of like mask bans from Karen Bass, the Los Angeles mayor, floated one. um,
Right, which
and
is
and now she's bragging about like distributing N95s to
yeah.
to Los Angeles, to Angelinos for free. So it just kind of shows like our politicians are still really unaware of and not interested in preventing the spread of COVID-19 or really keeping people safe. So these mutual aid groups are essential at this time.
mutual aid. I mean just community support groups.
Yeah.
Okay. Okay. Anything else you want to share? Or I think we've covered quite a lot in not that long a time.
Yeah, I mean, I guess the other main thing I should say in terms of our progress is, have we're very grateful to everybody who's financially supported the sick times, both in terms of grants, the biggest being from CanRo, the biotech giving fund that has also supported a lot of research that we got last spring, and that is still, supporting like a lot of our budget, through like fall of this year. And all the donations from individual readers and other groups. So, very, very grateful. And hopefully gonna continue to build on that this year.
Okay.
Um,
Well,
last year we were not paying ourselves. Now we are paying ourselves. We're still not at the like full-time salary level, but making good progress, I think.
I understand. I
Yeah.
understand. Okay. Well, listen, let me thanks for joining me and talk to you soon.
Thanks
Bye.
for having us.